So I'm just going to wait for others to join us before we start. We just come in. Hello, everyone. Yeah, we are ready for today's live. Hello, hello. We're just going to wait for people to join us before we start. We are ready. So if you missed my live this morning, it's not bad. If I was unable to answer your question this morning, this is an opportunity for you to ask that question now. So let's get started. It's going to be an interesting and interactive section tonight. Yep. It's going to be an interesting, and trust me, it's going to be an interactive section tonight. So if you are joining our live for the first time, my name is Nurse Mercy Mary. I am a registered nurse and also a registered midwife in Nigeria. All right. Hello. If you're watching, all you just need to do is to drop your name, or probably where you're watching us from, what you're doing at the moment. Just drop something on the comment section and let us know you are watching. Hello, Abdul Kash. How are you doing? I trust you're doing great. It's a beautiful evening over here. So I won't really want to waste any time. So I would like to actually start on time and talk about what I need to talk about. So I'm just going to give the next 1 minute to actually get all that's coming. 1 more minute and we'll be starting off. Just drop on the comment section. Let me know you're watching. Say hello in the comment section. It's Nurse Mercy Mary here. All right. We have 30 seconds. I still have 30 seconds to wait for others. We still have 30 seconds. 30 seconds and we are going to start the topic now. 30 seconds and we're going to be starting the topic now. Hello Sarah, how are you doing? Trust you are doing great. It's a beautiful evening over here. Oh, thank you very much, Blue Code. Thank you very much, Blue Code. Abdul Kash said hi from Ghana. Hello, Abdul Kash. Thank you for joining our live today. All right, so it's 3 minutes, so we're going to go right into the point. So let me do a formal introduction here. Hello everyone and welcome back to Nurses Lecture Room YouTube channel. My name is Nurse Mercy Mary. Like I earlier said, I am a registered nurse and also a registered midwife. On our YouTube channel, we talk about health in general, and most of our videos are about sexual and reproductive health. But those that have been following us, you know that that is what we talk about. What you are scared to ask your doctor about, we talk about it. We try as much as possible to explain it in simple terms. And some of those things that your doctor is not going to have that time to actually discuss or explain to you, we actually talk about that on our YouTube channel. So while this conversation is going on about the male fertility, feel free to drop your questions in the comment section and I will be willing and ready to take all your questions as we go in. So we have Israel from Lagos. Hello, Israel. Hello, Yetunde. How are you doing? Trust you are doing great. So in order for me not to forget the key points, so I actually kept the key points here on my phone. While this is going on, like I earlier said, drop the questions in the comment section. And if you are watching this live, all you have to do is to double tap the screen to like the live. And if this is the first time you are coming across our YouTube channel, so what I advise you to also do is to subscribe to our YouTube channel, turn on the notification bell so you get information whenever you get the notification whenever we upload our video. All right. Hello Yetunde, how did you overcome phobia from BP machine? Okay, sorry, before I start, I think here today is a student nurse. I think the best way to overcome phobia from BP machine, if you are a student nurse, is to do it at home. If you have a BP cough or your personal BP cough, do it for as many people in your area, your family members, your brothers, your sisters. Just do it for somebody around you. The more you do it, the more that phobia will go away. So let's go back to the topic we're going to be talking about today, and that is the male family planning method, the male method of contraceptive. Is my voice not clear? Please, let me drop the mic and use my natural voice because I was having issues with this mic. If my voice is not clear, let me know so that I can drop the mic and use my voice. Is it clear? Is my voice clear, please? If it's clear, let me know. If it's not, let me just drop the mic and use my natural voice. Hello, I'm Lou. How are you doing? Trust you're doing great. Okay, it's better now. Okay, that's good. So I'm going to be talking about, the first thing we're going to be talking about is family planning. We're going to be talking about the male family planning. First of all, when you hear about family planning, the main goal of family planning is for a child not to come while you're having sex. That is the reason for a family planning. You don't want a child, but you want to keep involving in sexual intercourse. You want to have sex with your partner, but both of you don't want kids. So that is why couples actually think about family planning method. So these days, family planning is not just about the woman, it's also about the man. Family planning is a two-way team. It's for both the man and the woman. So it's not the decision of the family to ask who is going to do the family planning for us. Is it the man that is going to do the family planning or the woman that is going to do the family planning for us? So on this particular video, we're going to be talking about why men need to be part of the family planning. We're going to be talking about male contraceptive options, the various options for men that want to go about family planning. And we're still going to be talking about vasectomy. We are going to be talking about vasectomy, facts versus myths, what you need to know about vasectomy. We are going to be talking about castration. Is castration really a type of family planning? Is castration a type of family planning method? So all these things we're going to be discussing on this particular video. And while we are doing that, if you have any question at all, kindly drop in the comment section. And if you are understanding and you are following, don't forget to do the thumbs up. Don't forget to like the video. So the first point we're going to be talking about is why men need to be part of the family planning. Why do you feel that men need to be part of family planning? The reason why men needs to be part of the family planning, the number one reason I want to say is that it is not just a woman's responsibility. It is not just a woman's responsibility. When it comes to giving birth to a child, it's not the woman alone. It's both the man and the woman. So men should also get involved when it comes to family planning. If it's just a woman's team, then you should leave it for them. But since both parties are involved, since both parties are having sex, definitely both parties should take responsibility for not having a child. I've seen a situation where a man was like, oh, I told you to protect yourself. You did not protect yourself. Now you have a child. This is our fifth child. Who is going to take responsibility? I bought the baby. I don't want. And I got a message from that woman. I was like, why will a man do that? Okay, fine. You don't want a child. You didn't talk about family planning with your wife. But yet you keep having sex and you put the whole blame on the woman. Sincerely, that is not fair. It is a shared responsibility. So if you are having sex as a man with your partner, it is important for both of you to sit down together and talk about family planning options and the best one that suits both parties. So for the men out there that keep blaming their wives whenever they are pregnant because they feel they are not financially capable to take care of that child, I just want to let you know that when it comes to family planning, it is a shared responsibility. So if your woman is not thinking about family planning, you can also think about family planning. Then I have already explained it. Preventing pregnancy is a shared choice. I've said that. And men can take active role, not just the support ones. The fact is, it's very easy to say, oh, just go get your family planning. Just go get your family planning. You'll be fine. We will not have kids. But do you know a lot of women actually go through a lot because of family planning? Some actually experience bleeding with family planning. Some experience increased weight gain with family planning method, the peak. Some experience mood swings with family planning method, the peak. So you have to be supportive as much as you can. If you find that your partner is trying to use a family planning method, but it is not working for them, they are either bleeding, they are experiencing mood swings, and if you can help as a man and you feel you are done giving birth to children, the next thing is to consider the male type of family planning method. Okay, so Clayman said, why? Why what? Why what? So I really want to ask a question. And the first question I want to ask before I go about the male contraceptive options is, do you think male contraceptions are well talked about? Do you think we talk about it enough? Do you think like we explained it enough? Do you think it's all over social media enough? Do you think people are educated enough about the male family planning options? Please let me know in the comment section. Do you think this is talked about enough? Do you think the male contraceptive options are talked about? Let me know in the comment section. Is it a yes or a no? Let's see if I can do is it a yes or a no? Sorry. I'm just going to see a poll. Sorry. Just give me some time. I want to do a poll for this. Okay, not really. Lolade Yetunde said, not really. Judith Saleh Latus said, sorry if I didn't pronounce your name properly, Judith. It's not my fault. Kindly bear with me. It said, not enough. Okay, so male family planning method, I feel, for me personally, I feel they are not really talked about. Do you feel? Sorry, I don't know why this is coming out. I just need to get this out. I don't want to start. Okay. Do you feel it's being talked about? Do you feel male fertility, male family planning is being talked about? So it is time for us to educate everybody out there that it is not just the women that should be getting this family planning method. It is not just the women that should be talking about fertility, but also the men. So the next question, the next topic we're going to be talking about, which is the main reason for this video, is male contraceptive options. What are the options for our male? Yes, we say, okay, the women have hormonal regulators, this and that, this, they should try it. So what are the options for men? I know the first one is going to sound shocking because when we hear family planning, that one is not always on the list. We feel that one is just there. It's not a family planning method. The first on my list when it comes to male contraceptive measures is the use of condoms. Yes, condom is a type of family planning method. Condom is a type of family, both the male condoms and the female condoms, they are a type of family planning. So when you're talking about family planning, don't skip the use of condoms. Okay, so condoms are actually very accessible, they are easily accessible, but they are not 100% effective. Same like other family planning methods, they are not 100% effective. But when used correctly, it can do some magic. It can help prevent unwanted pregnancy and also STIs. So condoms are the only types of family planning method that helps to prevent STIs. That helps to prevent STI. So let's talk about the second one. The second one is still not 100% effective. It's a risky, it's a dicey thing, and that is the withdrawal method. Yes. So we're starting with the little ones first, in case you don't just want to take that big that big decision yet of going for vasectomy. So I'm starting with the little one first, so you know. So the first one we talked about was condoms, and the second one I'm talking about is the withdrawal method, which is also known as the pull-out method. Still, the pull-out method is not very effective because there's a saying when it comes to that pull-out method, and that is it's not that easy to jump away from a moving train. You understand what I mean? It's not really easy to jump away from a moving train. So pull-up method is also a type of family planning that the men can imbibe in if they are trying to prevent pregnancy, but they are not ready for the big one. Okay, so that is for that. Then the other one is the hormonal method. The hormonal method is still on trial, is not out yet. Yes, they're still working on it. Research are still going on in such a way that men can have injections, men can have tablets, and they are able to prevent pregnancy. So that is still on trial. That research is still going on. It's not out yet. So that is the hormonal method. So another method is abstinence. You heard me. Abstinence is also an option. It's also an option. If you don't want a child, then abstain from sex if you can. So that is that. Then the number one option I want to share with you for the men is vasectomy. Yes, vasectomy. So since the hormonal method are not working for us, and also since you don't want to use the withdrawal method, you don't want to use the condom because you prefer it skin to skin, like you always say, like they always say, you want it skin to skin. If you don't want to use condoms, you don't want to use the withdrawal method, and the hormonal methods are not out yet for sale. So the options that is available for the men is to go for vasectomy. And vasectomy simply means that they are cutting the tube that carries the sperm, that transfers the sperm into the semen. For example, this is a tube. For example, how do I explain this now? I'm trying to explain what vasectomy is all about for those that don't have idea of what vasectomy is. Very soon I'll be getting a board. It will make it much easier for me to explain for everyone to understand. So what vasectomy is that they are removing a tube that actually transfer the sperm from where it is being produced to where it will carry out its action. Let's use it that way. For example, this is the tube. For example, this is where this mic now, let's say this mic is where the sperm is being produced. So this is a tube known as the vas deferens. So this tube is the one that carries the sperm from this place to join the semen. So when the tube is cut out, that is what is called vasectomy. In vasectomy, what they are simply doing is that they are cutting the tube that transfers the sperm. They are not cutting your sperm production. Your sperm is being produced, but the sperm cannot travel. The sperm cannot travel to where it will be used. So what they are cutting is the tube. Don't feel, oh, when they cut the tube, when they do vasectomy on me as a man, I'm not going to be man enough, I'm not going to have enough sperm, I'm not going to ejaculate anymore. It's a lie. Okay, in vasectomy, what they are doing is that they are cutting the tube that transfers the sperm from where it is being produced to where it's going to join the semen. So that is another type of family planning method. So I want to ask a question in the comment section. Please and please, I will need your honest opinion. And that is, if you are a man, would you like to go for vasectomy? I'm waiting for the answers in the comment section. If you are a man, would you think about vasectomy? Or it's not something you should do, or not really, or you're not interested, or the woman should do the family planning? Let me know. Let me know if you are a man, if you will be able to, if you will be interested in the family planning. So we have Josh. Josh Kryptonite said hi. Hello, Josh. How are you doing? Josh, please let us know if you would like to do the vasectomy. So Yetunde said, can the tube be replaced once such man is ready? Vasectomy is usually seen as a permanent method of family planning, but yes, it is reversible. Yeah, it can be. It can be. It can be, yeah, it can be. All right. So, Josh, there's a question on the group chat and on the live. And that question is, would you, okay, Josh has replied. I need all the men in the comment section to actually answer this question. Would they go for vasectomy? And if your answer is yes, why? And if your answer is no, why won't you? So let me know why you would not think of going for a vasectomy. Why would you would not think of taking that tube? Then we'll talk about the myths. I want to know your fears. What are your fears? What are your fears? It is surgical. It is surgical. Yeah. It is surgical. So let me know why you as a man would not go for vasectomy. So, Yetunde, why won't you allow your husband to do such? I really want to know. This is actually a very interesting thing. Why won't you allow your husband to do a vasectomy, Yetunde? I want to know. Then, Josh, why won't you do a vasectomy? I'm going to be explaining like how the surgery is. I'm going to be talking about it, but I really want to know. We've talked about the vasectomy already. So, Yetunde, can you please let us know why you would not allow your husband? Okay, Yetunde said it is surgical and it is life risky. Josh, is that your fear? Josh said, I don't like surgery. I think, okay, Josh said, it would be kind of scary. I don't like surgery. It is a surgical and life-threatening risking. Okay, let me shock you. Let me shock you about vasectomy. I want to shock you now. Are you listening? Please, if you've gone, please come back online. This is very important. I think we have to know what vasectomy is all about. It's not really risky per se. Okay, normally when you talk about surgery, if you are going, just stay back because this is like, it's very interesting what I want to say now. When you're talking about surgery, most people feel, oh, a big knife has to cut through your body and you have to spend days in the hospital, you have to be admitted, you have to be given painkillers, they have to give you antibiotics, they have to put you on monitoring because it is a surgery. The thing is, vasectomy is an outpatient surgery. It's a quick procedure. The same day they are doing it, the same day you are going home. You're not even going to sleep. It's an outpatient. That's why they call it outpatient. They tell you, oh, come 9 a.m. today, you're going to be having your minor surgery done. You are there 9 a.m. Soon they are done and you go back home that same day. It's a day surgery. It's an outpatient surgery. It's not something that takes a couple of hours, like 10 hours, 15 hours, you'll be in the hospital. No, it's that same day surgery. You go home. So that's a myth. Please and please, you don't have to be scared. If you've done appendix before, you've done cesarean section. Women have done cesarean sections and you've taken appendices out, and an appendix, you stay longer in the hospital, maybe a day or two, and you go back home. But this vasectomy, it's not involving you staying in the hospital. It's a same day surgery. You go home that same day they are doing the surgery. So it's not really a big surgery, it's a minor surgery. I hope we get that clear. So that takes us to the fact and myths about vasectomy. It is a minor surgery. It is a minor surgery. Please and please, there's also this question that's going to pop up, and that is, do you think vasectomy affects sex drive and erections? Do you think vasectomy affects sex drive and erections? DN, what's up? How are you doing? Trust you're doing great. So we're talking about options of family planning for men. So we're talking about vasectomy now. And now there's a question. Do you think that vasectomy procedure affects sex drive and it also affects erections? Let me know in the comment section. Let me know in the comment section. So the ordinary president's son said hi. Hello, President's son, President General. Hello, how are you doing? So Josh Kryptonite said, okay, Nurse, thanks for the heads up. You're welcome. I'm glad you understand better. It's not a big surgery, it's a small surgery. You do it that same day and you go back home that same day. So it's not a big surgery. So if you as a man, for me, if you as a man know that you don't really want kids again, then do it. That's what I would advise though. Because it's a quick surgery, it's not really, the risk of losing your life or something is very slim, I would say. But to get a personalized advice, you have to speak to your doctor. Let them tell you face to face what it entails. Okay, so the question I asked is that, do you think vasectomy, that's this procedure that removes, that's the family planning method for the men, do you think it actually affects a man's sexual drive or erection? I'm going to be answering, but I want to know from the audience what they think. If they think it's going to affect erections, do they think that it's going to affect sex drive? Am I getting a question? Am I getting answers to that question? I don't even know about that. Okay, so just kryptonite, I'm going to explain. Thank you very much for at least giving me, dropping on the comment section that you're there. Thank you. Okay, in terms of vasectomy, it doesn't in any way, it does not affect a man's sex drive, and it does not affect erection. In the sense that in vasectomy, they are not removing your testicles where the sperm is being produced, where your testosterone is, where they are producing your testosterone and all those male hormones. It is not affecting your hormones as a man. It's not affecting those hormones. So it definitely does not affect your sex drive. So you need to know. So what did I say? Vasectomy does not affect your sex drive, and it also does not affect erection. Your sperm stays same. You can still ejaculate with vasectomy. You can ejaculate with vasectomy. Just that when you ejaculate, there is no sperm in it. It's just semen. The semen is empty. There is no sperm. It's just like water and Milo. So when you ejaculate, there is no Milo. There's just water in it. That's how we just used to break it down. So that is what happens. So it is considered a permanent procedure, but sometimes it can be reversible. It is considered a permanent procedure, but sometimes vasectomy can be reversible. So then that takes us to the next heading, and that is castration. I think there are a lot of myths about castration. I want to ask the house a question. Do you know what castration is? And is castration a type of family planning? Do you have any idea if castration is a type of family planning? And also, do you know what castration is talking about? I'll wait in the comment section. So ordinary president's son said no. Okay, I don't know. So I'm going to be explaining it. Do we have people in the house commenting? Do you know what castration is about? Okay, Yetunde said no idea. That's good. Let me hear from somebody else. We have a lot of people watching. Just Kryptonite said no. All right, that's good. So I'm going to be explaining this now. Now we've got 3 people saying they don't know. So what is castration, and how is castration different from vasectomy? In castration, they are removing the testicles. In castration, they are removing the testicles of the man. And the testicles of the man is that place where that man hormone, your testosterone, is being produced, is where sperm is being produced. They are taking away the testicles. But in vasectomy, that is the ideal family planning method, they are not taking away your testicles. They are not taking away the place where your hormones are produced. They are not taking away the place where your testosterone, where your sperm is. They are not taking that. They are not touching it in vasectomy. But in castration, they are taking it away. In castration, they are taking away a man's testicles. Castration is not a type of family planning method. I think that's something we all should know. Castration is not a type of family planning method. Sometimes it is medically indicated for someone to do castration, probably because this person has cancer. And you know, for cancer, you have to take things away so it doesn't spread. Cancer spreads very fast. So you have to take it away. That is when castration is advisable. But growing up, I used to hear people say, oh, we will castrate him. He raped this girl. He did this to this girl. We're going to castrate him. They see it as a criminal, like justice for criminal activity. Oh, you steal, we will castrate you. You toast this girl, we will castrate you. I used to hear slangs like that. And I didn't really understand what castration was all about. So in castration, when a man is castrated, it is not reversible. When a man is castrated, he cannot give birth. When a man is castrated, there is no sperm. The sperm is gone. The testosterone level drops. It's going to affect a man's testosterone too. Unlike vasectomy, vasectomy does not affect a man's hormone. The vasectomy does not affect a man's sperm. But castration affects a man's hormone. It affects a man's sperm. All right, and it is medically indicated when someone has cancer most times. So that is when castration is usually indicated. What do I have here again? Okay, Yetunde is well understood now. So that's the difference between castration and vasectomy. So feel free to ask your questions. I am going to be here to take all your questions. I've been able to explain everything you need to know about the options of family planning method. And we've been able to talk about vasectomy. We've been able to talk about castration. And if you are a man and you are not going to do vasectomy, I would like to know the reason why you will not. And if you are a woman and you wouldn't like your husband to do vasectomy, I would also like to know the reason why. Thank you very much, Yetunde, for telling us why. Diamond Weight Loss said, I know it is stinking. Vasectomy is not an issue. It's a clean procedure. It's a quick procedure. It's a quick procedure. Vasectomy is a very, very quick procedure. Sorry, I have to check my child. Vasectomy is a very, very quick procedure. Okay? So I think our next live, okay, what do we have? Yetunde Lolade said, I need you to explain what Staphylococcus is all about. If you need me to explain everything about Staphylococcus, that is going to be on our next live tomorrow. I will explain it in details about Staphylococcus. But Staphylococcus can cause, it's actually in the skin. Yeah, it starts from the skin. So I'm going to make a detailed notes on it, and we'll discuss it tomorrow live. Hopefully same time by 10 p.m. tomorrow. So we'll talk about Staphylococcus. If you have any questions in regards to Staphylococcus, because Staphylococcus is broad and I won't want to just hit it on the head and not go into details. Since you want to know everything what Staphylococcus is all about, so we're going to do a live tomorrow, hopefully by 10. I'm trying to make sure my kids sleep by 9, so 9 to 10 I'll prepare for my live and come. So tomorrow by 10, hopefully we'll be here to talk about Staphylococcus and everything you need to know about Staphylococcus. So we have just said, sorry nurse, what about the first two options? Please, I want to know, I joined the live at the third option. Okay, Josh, the first option we gave is the common one that we neglect, and that is the use of condom. Because most times when people hear about family planning, condom is not always in the radar, but condom is a type of family planning method. So it's the only family planning method that actually prevents pregnancy and also prevents you from sexually transmitted infection. So condom is the first option. And the second option is actually the pull-out method, the withdrawal method. So those were the first two options we talk about. The second option is the pull-out method, the withdrawal method. I will also add to that pull-out and withdrawal method, and that is a lady knowing how to calculate their cycle. So as a man, you can actually help your wife to calculate their cycle. In our lives, in our coming life, we'll be talking about how to calculate their cycle for you to have a better understanding. So expect that soon. So knowing how to calculate your cycle, your wife's cycle, because we're talking about the men today. We're talking about the men today. So as a man, I'm not talking about the women now. I'm saying as a man, you can also learn on behalf of your wife how to calculate their cycle. So when you have an idea of your wife's cycle, you know when they are ovulating and you try not to even pour in, you try to use the withdrawal method if you have to have sex during that period. And when they are ovulating, you try as much as possible to avoid sex during that period. So that can also serve as a natural method of family planning. Knowing their cycle, knowing when they are ovulating, knowing their safe days and unsafe days, that is going to help, trust me. So that's that. So those are the first two options about male method of contraceptive that we talk about. So I'm waiting for more questions. I need more questions on this live. If you are coming across this YouTube channel for the first time, my name is Nurse Mercy Mary. I am a registered nurse and I'm a registered midwife. I am here to explain things in simple terms to you. I'm here to answer your questions. Those questions that you feel shy to ask your doctors, bring it to nurses lecture room and we'll answer it for you as much as we can. Those questions your doctors don't have the time to explain, we'll answer it based on the knowledge I have from school. Then if you need details, you might likely go back to see the doctor. So we talk about your health in general on our YouTube channel. So if you've not subscribed, this is the first time you're coming across our channel, I would advise you to go back to our channel and click on that subscribe button and turn on the notification bell. So whenever we pop up to go live, you are going to get the notification and you're going to rush down to our YouTube channel. So in the morning, I do come live to take questions because in the morning I have a me time too. Same way I've been able to sleep, train my children in such a way that I have my own personal time to do what I want to do. So now they're sleeping, I have my own time to do what I want to do. So in the morning, I wake up on time so that I can also do what I want to do. I can exercise, study the word, pray, and do life in the morning before I start their own personal routine. So I'm going to be live tomorrow after my exercise, after running. I use the treadmill to run just to keep active since I'm not working. So after my exercise tomorrow, I'm still going to come live. So for those that want to join my morning live tomorrow, feel free to pop in and also ask your questions. So we have Ezra Agie. Hello Ezra, how are you doing? Trust you're doing great. We have the honorary president son said, can you answer my question? Yes, we are here to take your questions, your health related questions on our YouTube channel. So kindly ask and I will be ready to take it. So we have Lokash Varada. Hi, hello Lokash. How are you doing? Varada looks Indian. I have a lot of Indian friends and I have a lot of Indians coming on my live. Thank you very much to my Indians in our community. I really do appreciate. Don't forget to share our YouTube channel. Don't forget to share our live sections with your friends so that they can also benefit. Okay, so that's that. So I'm waiting for your questions right now. So I'm waiting for your questions because immediately live, I tend to sleep. Immediately after my live, it's my bedtime. I will try to wake up before my kids so that I can also have my me time. So that's how I've been able to preserve my mental health. So while waiting for your questions, we are done with the men. Not really. I'm waiting for ordinary president son's question, but there's something I want to chip in for the mothers here. I believe we have a lot of women here and we have a lot of mothers here. As a mother, especially those that don't really have help, they don't have nanny, they don't have somebody helping them, you need a space. You need space. You need time for yourself. You need time to do you. You need time to do what you like. So the best thing to do is to actually create time for yourself. You actually, like what I do now that helps me is that first thing is deep training them to make sure that they are sleeping at the particular time. So once they are sleeping, there's no, oh, he didn't sleep by 12, he didn't sleep by 1, he's disturbing me. No, it's my time. So nobody can intrude on my time. I can spend time with my partner. So in the morning, I wake up, calm my head down. It's just me alone. Nobody's shouting, mommy, mommy, mommy. Nobody's shouting. It's just me alone. And that is what actually helps me. That's what is actually helping me to stay sane in a world where I have 2 kids and I'm the only one looking at them. So if you're a mom, I would advise you try that because you need a time to breathe without somebody saying, mommy, mommy, mommy. All right. So Just Kryptonite said, please, family planning for women. Then we have Varada. Your channel is good, informative. This is Dr. Lokash Varada. Thank you very much for appreciating my channel. I really do appreciate you for that. Thank you, Dr. Lokesh Varada. It's nice having you on my YouTube channel. So let's go back to Josh Kryptonite's question. He said, please, family planning for women. So same way we have family planning for men, we also have family planning for women. For the women, the first one I will also say is the natural. Let's talk about the natural method for women. For the women, we have the calculating their using their cycle. I think I gave you some insights before about women knowing their cycle, understanding their ovulation, when they are ovulating, when it's time to release egg, when they are fertile, when they are not fertile. So knowing their cycle as a woman is going to help when it comes to family planning method. It's a natural type of family planning method. The second one is still condom, withdrawal method. All these things are part of the natural method for women too. Then in terms of women, they have the hormonal method of family planning. We have the intrauterine devices. Women have a lot, especially the hormonal method of family planning. This family planning method actually alters the hormones of women. You see some women after family planning method, they start having mood swing, they start giving attitude. It's not their fault. Just try and understand them. Okay, so women, they have some injections they take depending on the type of your injection. So I'm just explaining. So some take injections every 2 months, some take injections every 3 months, and there are also pills. There are pills that can be taken daily. You take these pills every day. So if you say, I want to be taking these pills every 5 a.m., every 6 p.m., you take it every day on that particular time. That is when it's advisable. So there are some pills that women can take. It's a type of family planning method. And there are also some implants that can be put in their arms. These implants are buried in their arms. They are placed in their arms. That is a type of family planning method. Then also there are some things that can be put intravaginally, that's through their vagina, which is the intrauterine device. It goes through the uterus, is an intrauterine device. So that device actually blocks the sperm from reaching the eggs. That is also another type of family planning method. So if you want me to do a live section explaining in details each type of the women's family planning method, feel free to drop in the comment section and I will do that. But our next live section, we're going to be talking about staphylococcus. Everything you need to know about staphylococcus. So that's what we're going to be talking in our tomorrow evening section, not the morning, because morning is just to take questions after exercise. It's not like the time I talk about a particular topic. All right. So that is that. I hope, Josh, you get what I'm saying right and you understand what I am explaining. So let's keep the questions coming. Please and please, if you're watching this video, you've not double tapped to like the video. What are you waiting for? We've talked a lot on this channel. We've answered a lot of questions. Why don't you double tap and like the video? That shows you appreciate the work we are doing over here. So we have a question from Israel. Israel said, can you please explain to me why my menstruating date changes when I get in June? Can you please explain to me why my menstruating date changes when I get in June, half of the year? Okay, I don't really understand your question, Israel, but a lot of things can actually affect the date of your menses. They can actually affect the time your menses come, the date. You don't have to be focused on the date. You have to be focusing on your cycle. I don't know if you understand your cycle. Your cycle is not like, oh, it has to happen every third of the month, or every fifth of the month, or every eighth of the month. That is not cycle. Understanding your cycle, it varies. I don't know if you understand your cycle properly first. That's the first question I want to ask you, Israel. Do you understand your cycle? Do you understand when I say I have 28 days cycle, I have 30 days cycle, I have 50 days cycle? Do you really understand? I would like to know, Israel, because there are a lot of factors that can actually affect your menstrual date. Stress. Let's talk about stress can affect your menses. Stress can either delay your menses or make it come quickly. Outside stress, if you are on any medications, for example, you are treating malaria, you are on some medications, those drugs can actually alter your menses. It can delay your menses, it can make them come on time. Medications alter your cycle too. All right. So how many days cycle do you have, Israel? How many days cycle do you have? And why did you feel that it changed? It changed. The ordinary president's son is saying in less than 5 minutes. What do you mean when you say in less than 5 minutes? So you have a 27-day cycle. So how many days are you not having now? How many days are you not having now? Israel, how many days are you not having now? I really wanted to know how many days intervals are you now having now. But while I'm waiting for that, I don't know if the seasons, I can't remember the seasons. Please permit me to say I did end the last month on when I got released. I am menstruating. Israel, your question is not clear, but there's something I want to let you know is that seasons affect your period. That's one thing you should know. It's not everybody it happens to, but the season you are affects. Rainy season, dry season, summer, winter, it affects your period. I think that's something I'm going to be discussing in detail soon. Like sometimes people, when they are in the summer period, that's when the weather is very hot, there's sun, the menstrual cycle tends to be shorter. But when it's cold, the menstrual cycles tend to be longer. All right, so seasonal variation can happen, can make the alteration in your menstrual cycle too. Just give me one. Israel, I don't really get the last your last sentence and what you're saying. I didn't really get that. Let's keep the questions coming. If there is no question, as usual, we'll be going offline. But let's keep the questions coming. We've talked about what we need to talk about today. We've answered as much questions as we can. And it might be time for us to say bye, but I want to make sure we get to 1 hour on the live. So we have like 14 minutes to go. Feel free to ask your questions. I am waiting. Do it again like a crabby, 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 crab do. So let's keep the questions coming, please. Israel, did you get what I said? Are we done with the questions for today? Okay, Israel said, I have now understood it. That's good. I'm glad you understand it. I'm glad we're able to provide answers to you. All right? Do it again like a crabby, 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 crab. So let's keep the answers coming. So Israel, I want to know, do you really experience it every year? You notice that this happens every year? That means you're very observant about your body, because most people will not even observe the changes. They just know, oh, sometimes my menses alternate, my menses fluctuate, and that's it. So I want to know if you observed it like every June, every year during the June period, my cycle changes. Did you personally observe it? Wow, that's good. I like when people personally, I didn't really observe mine. I like when people are really very observant about their body. It's like they have control over their good God. Like Israel, like I would say, like thumbs up for you. You're doing I think I'm supposed to have this picture to clap for you on this sound card. You're really doing a good job. Like it's also you really do. You're really doing a good job to have observed that over the period of 2 years. You know, we humans like, oh, it's just fluctuating, but we don't really take into consideration the reason for its fluctuations. Personally, I didn't really take into considerations my fluctuations. See, I started understanding that seasons can affect my menses. All right, so that's good. That's good. That's good. That's really, really good. I'm looking for the clap features, but I can't find it. Okay. Yeah, I think that clap is for Israel. I hadn't used the sound card anyway, but I decided to use it today for Israel because it takes someone that is very, very observant about their body to notice that. It takes someone that is very observant about their body to notice that there's actually fluctuations in their cycle at a particular time of the year. It takes a lot, and that's great, Israel. It's nice having you on my life, Israel. Thank you very much, and I like that question. So let's keep the questions coming, please. Just keep up the good word, have charge over your body. Because when you understand your body, it just gives you this power over your body. Like, you know what is happening around you, you know what to expect in the next 3 days. It's not your messes catching you by surprise, I mean. So that's good, Israel. Okay, we're waiting for more questions. Please and please, if you've not double tapped to like the video, can you do so now? And also, if you have not subscribed to our YouTube channel, kindly do so. It has been an interesting section so far. And if you are just coming across our YouTube channel now, you're late. Why are you late? We started 10 p.m. and it's almost 11 p.m. And all, thank you for joining. And if you've not subscribed to our YouTube channel, kindly do so. Kindly subscribe to our YouTube channel. We have a lot of educational topic and stuff for you. They are already there. All you just need to do is to search that topic and put by nurses lecture room, and you're definitely going to get a video in regards to it. Trust me, we are here to explain everything that seems difficult in your ears to you, which is a good one, right? So if you've not subscribed to our YouTube channel, kindly do so now. And if you've not liked the video, kindly do so. Kindly do so. If you've not liked the video, kindly do so. If you've not liked the video, kindly do so. Just double tap and like the video. Just double tap your screen and it automatically, okay. I think we have another question. Israel said, can season affect your menstrual pains? Yes. I think these are topics that should be discussed. And thank you very much, Israel. These are topics that should be discussed. They affect it, but we don't talk about it. Yes. Seasons can actually affect your menstrual pain. When the weather is cold, like during the cold season, you are more likely to experience more pain when the weather is cold. Why? Because during that period, there's a reduced blood flow. Like, blood flow is not, when it's sunny, the blood flow is like active. Let me use that language. But when it's cold, the blood flow is not active. So I don't know if that's what you notice, Israel, too, like if that is similar to you, but generally, people are more likely to experience more pains when the weather is cold than when the weather is hot. So season can affect the menstrual pain. Is that okay, Israel? And I would like to know your experience too. So do you feel that when it's cold there's more pain, and do you also feel that when it's hot there's lesser pain? I would like to also know that. And permit me to screenshot these your questions. I like them because a lot of people need to know about that. I think somebody came late. I think Mustafa came late. Mustafa, you came late. We've explained everything and we are in the question and answer section. Mustafa, you came late. Why did you come late today, Mustafa? Why did you come late? You came late. I'm going to give a summary. When the weather is cold, it comes in cramps, but it's summer in liquid. Yeah. So when it's cold, it's a whole lot. All right. That's good. Thank you very much, Israel. I think this is something I should talk about too on my YouTube channel. So I will talk about it, maybe using a short video or a long video to actually talk about it soon. So thank you very much, Israel. So Mustafa, let me give you a summary of what we've talked so far. We talked about the male involvement in family planning. One of the May family planning we talked about, May family planning is actually the use of condoms. The second one was the withdrawal method. The third one was vasectomy. Vasectomy is the May family planning method. And we talked about the hormonal aspect. The hormonal aspect is still ongoing. Research is still ongoing on it. It's not finalized yet. Then we also talk about abstinence. Abstinence is also another method of family planning method, which does not suit well with everybody. But the main family planning method outside condoms, withdrawals, is actually vasectomy, which we've explained in details. And also in our video today, we talk about the difference between vasectomy and castration. And we made it clear that castration is not a type of family planning method. Castration is the removal of the testicles, while the vasectomy is just to cut the tube. It's a minor surgery, it is not a major surgery. In vasectomy, a minor surgery is being done. It is not a major surgery that is being done. It's a day case. We explained that people do it and they go back home that same day. They don't need to stay in the hospital for long. It's a very quick procedure. So vasectomy is a very quick procedure. We talked about it. That's more or less like the summary. But if you want a detailed explanation of this video, what you should do when the live ends, you can play it again. It's going to be saved on our YouTube channel. You can play the live again to get the full details about this, the various types of family planning method available for the men. You actually came late, but that's the summary of what we've been talking about so far. But if you want the details, the best thing you can do is to play the live again and also hear what other people have to say on the live section. And we actually dropped a question and asked if they would like to do a vasectomy. We found out that most people don't really know what vasectomy is, and we were happy to explain. Nurses Lecture Room is a brand, so it's not just me. I was happy to actually explain vasectomy, and I was glad that a lot of people got benefit. So if you are just coming across this live section, you are late. It's okay to be late. I guess you're busy or you had one or two things to do. That's fine. That's perfectly fine. But the good news is that you can also have access to this live video. All you have to do is that when the live video ends, go and watch the video. You have everything in the video. So you have access to what has been taught in the class so far. Then if you are coming across this channel for the first time and you've not subscribed, all you have to do is to go to our YouTube channel, which you are right now, which you're watching right now, and click on the subscribe button and also turn on the notification bell, because our live sections are both in the morning and in the evening now. So in the morning, it's going to be after my morning routines, after my exercise and few things I do in the morning. I'm going to just pop in for 30 minutes to probably 40 minutes to do a brief live. Then in the evening, it's more professional. My uniform. I'm here to talk about a particular topic. So tomorrow on our live video, just a reminder, we're going to be talking about staphylococcus. We're going to be talking about staphylococcus. This was a question one of our audience, one of our subscribers asked today on our live. She asked us to talk about staphylococcus, and that's what we're going to be talking about tomorrow evening, probably by 10 p.m. So if you want to know more about staphylococcus, I would advise you to show up on our YouTube channel by 9-10 p.m. But it's going to be probably 10 p.m., but we might come by 9, depending on my kids anyway. So between 9 and 10 p.m., we're going to be having a section tomorrow on staphylococcus. All you have to do to get a reminder is to subscribe and also turn on the notification bell so you can have access to it. So that is that. And if there's any topic you would like to discuss in our future live sections, I will advise you to drop in the comment sections or drop a message on Instagram and tell me what you would like us to discuss in our next live sections. All right, so that is that for that. Thank you very much. I really appreciate all of you. And if you've not subscribed, do that now. What are you waiting for? It is Nurse Mercy Mary. I'm a member of the UK YouTube Health, and that is my name here, Nurse Mercy Mary. Okay, so I teach and you learn. We teach and learn from each other. I learned from you today, and you also learned from me too. That is the benefits of social media too. You'll learn more about your health. I'm glad for the social media space. The social media space has given us another opportunity to learn a lot about our health, to ask questions about our health and get useful information too. So like I earlier said, if you're coming across this channel for the first time, My name is Nurse Mercy Mary, and if you've not clicked on that subscribe button, subscribe, turn on the notification bell because you're going to be expecting more from us. Hello Chinasa, how are you doing? Trust you are doing great. It's a beautiful evening over here, and we have been having an interesting live section. And if you enjoyed the live and you've not liked the video, what are you waiting for? If you enjoyed this live section and you've not liked the video, I would really like to know what you are waiting for. So, hello Anna, do you have a question? If there is no question, I'll be going offline now. But if there is question, I can stay a bit. So we have some people that are just coming. We have some latecomers. Should I say latecomers? Anyway, we have some people that are just coming. So if they have any question, I'll just say in the next 2 minutes. If I get any question, I will answer. But if no question, I'll be going offline to see you in my next live. Do we have any question, please? Bibi, do you have any question for me? Chinasa, do you have any question for me? Bibi, okay, all right, that's good. So Bibi said, tell me about an astinospermia, treatment or remedy. So I'm not, I might not be able to pronounce it well, but I have an idea of what astinospermia is all about. So astinospermia simply means that the sperm is there, but they are not moving. They're finding it difficult to move. You get, the sperm are not there though. It's not low sperm count. The sperm are there, but they are not moving. They are not moving like they should move. They are not moving very fast. They are very slow. Let's put it that way. So that's sorry. Let me check. So that is what atenospermia is all about. The sperm are there, but they are finding it difficult to swim properly to the egg. They are finding it difficult to get to the egg. And that is also a major cause of fertility. Infertility, I mean, that is a major cause of infertility. In such cases, people that are battling with atenospermia, so one thing I would advise is that, especially when you're trying to conceive, the first thing I would advise is having a balanced diet, food rich in iron, food rich in zinc. They are very, very important. Having a balanced diet is going to go a long way to help. Exercising is going to go a long way to help. Quitting smoking. If this person is smoking, is an alcoholic, he drinks, it's better for you to reduce and quit smoking. It's better for you to reduce and quit alcohol, because that is going to go a long way to also help you with that. Then what I also advise you to do is to see the doctor, like the fertility experts. They might give you some tablets like zinc tablets. They might give you some vitamins that will help with the movement of your sperm. So not that this person have azoospermia. Azoospermia simply means that there is no sperm. But this actinospermia, it simply means that there is sperm, but these sperms, they are finding it difficult to swim to the egg. They are finding it difficult to get to where the egg is. And when they can't get to the egg cannot form a baby. So that's the issues with actinospermia. I don't know if you get that, Bibi. Bibi, do you understand that? Actinospermia is derived from azoospermia. So azoospermia simply means that there is no sperm, while actinospermia simply means that there is sperm, but the movement is the problem. So having a modification in your lifestyle is going to help, like balanced diet, eating a lot of veggies, a lot of fruits is going to help. Quit processed food as much as you can. Avoid heat around that scrotum area. So when you are always exposed to heat, when that scrotum area is always exposed to heat, it actually affects the sperm quality. So if you have a man that's always wearing those tight boxers, I would advise you to stop them, ask them not to, suggest for them, tell them not to actually wear stretch boxers. They should wear the free one that prevents heat around there. So that is one advice I would also like to give to the men, like prevent heat. Then if this particular person is a bus driver, is a truck driver, where they are sitting for too long and there's heat applied, if they can, especially when they are trying to conceive, if they can change jobs, that will go a long way to also help with the sperm quality. So that's that, BB. So just some vitamins I can get from Zurich, Switzerland. I don't know the policies in Zurich, Switzerland. I don't know this, but I know generally like there are these vitamins. The same way you have where man, where woman, they have some vitamins for, is it well products? They have some vitamins for men that are trying to conceive. So those vitamins contains the pack of things that men need, the essential vitamins that men need. So I'm sorry, I can't really suggest the vitamins for you to buy from Zurich, Switzerland, but you can check on Google and see what it has to offer in your area. But zinc is very important too. Zinc is very important. So let me check if I can help you out. Let's say supplement. Let me just check if I can help you out with it. Supplements for, let me see if I can browse for men. So one thing I would advise you to do is to check your Google for those supplements, those vitamins around your area. Okay, like what I can see, this was what I was trying to say, like the Wellmark conception mat. This is not like, I'm not advertising for them. This is just a suggestion. Like I earlier said, it's a suggestion. All right, I'm not saying it is a cure for it. So these Wellman conception marks, these well products. So if you are trying to conceive at a mat, this product like that, I think it contains the essential vitamins that are needed for men to actually to help them with their sperm health. So you can get those products that helps with sperm health. It's going to go a long way to help. But feel free to speak with your fertility expert or your gynecologist for personalized advice and care. So that's what I have to say, BB, and I hope it helps you out. I don't know if they sell well products in Zurich, Switzerland. I don't know. I don't stay in Switzerland, so I don't know their policies in regards to tablets, in regards to vitamins. So if you are watching and you've not double tapped the screen yet, what are you waiting for? What exactly are you waiting for? Why have you not liked the video? It's been an interesting section so far, I must confess. I really enjoyed today's live. It's been an interesting section so far. So if you've not liked, kindly like it now. The video is coming to an end. Kindly like it now. Yes, I said you should like it now so that we can go. Kindly like it now so that we can end the live right now. Thank you very much. So okay, somebody said, Rahime said, I'm scared going for a second baby. Is it normal? So first of all, why are you scared? What are your fears? I want to know. So for you to be scared of something, there's likely going to be a reason for it. And it's okay. It's okay to be scared. But what could that fear be? It's okay. Like, it could be your past experience with your first child, the labor, it could be the pregnancy period. These things can actually put fear in you. Or now that you're taking care of your child, the difficulties, the challenges you are having, it could put fear in you. So why are you scared of it? There's going to be a reason why you're scared of a second baby. If you would like to share in the comment section, I will. The ring of the fire and the tears. Fire and the tears. The ring of fire and tears. Rahi, what are you trying to say, please? I would like to know. I don't really understand what you're trying to get into. So, but I know people they're scared of second baby because of the experience they have with the first child. It could be they could be having some post-traumatic stress, PTSD, post-traumatic stress disorder, that's making them scared. or they are scared that they are not financially capable of taking care to the child, or the world is becoming toxic. So I would really like the ring of fire and the tears. That I don't really understand, Rahil. If you can make me understand better. So whatever your fears are when it comes to having a second baby, it is valid. Having a child is not a child's play. Having a child is not a child's play. As a woman, you go through a lot during childbirth. As a woman, you pass through a lot during pregnancy. Okay? So Raki said the ring of fire, tell as many call it, when the head of the baby is coming out. Oh, okay. Let me tell you something. First, one thing I have to say, Rahil, is that take a nice deep breath. When your first baby came out, was there something you were scared of? Did you have a tear? I didn't know it was called ring of fire. Seriously, I didn't know. I want to check about it, sorry. Because that ring of fire, when she said ring of fire, sorry. Wow. You see, there's something I know like about this interactive section. Is it like I've not seen it? I'm not seeing here. I'll check it later. Okay, I mean episiotomy as tear. Oh, hey, better now understand because I really don't see episiotomy as tear. Yeah, episiotomy is going to take time to heal. It's okay. First of all, Rahil, how many months is your child? How old is your child now? 2 years, 1 year, 6 months? Let me know. Let me know in the comment section before I know what to tell you. How old is your child now? So Bibi said, kindly tell me if it's okay. Menstrual cycle of 24 to 27 days. Yeah, it's okay. 24 to 27 days menstrual cycle is okay. It's fine. 24 to 27 days menstrual cycle, it's okay. Okay, Rahil said the child is 2 years and 7 months. Okay, let me just assume so that I don't, but if I assume wrongly, Rahil, feel free to correct me. Okay, feel free to correct me. So Rahil, you had a child for 2 years, the child is 2 years and 7 months. Deep down, you want to try for another baby, but you are scared because of the episiotomy and the tear. So if the episiotomy has healed, that's a good one. Like, just know that childbirth comes with a lot, all right, and your fears are valid. But if you can, try as much as possible to remove that fear. If possible, try as much as possible to calm that fear, calm your nerves down. Sometimes you had episiotomy with your first child, doesn't mean you're going to have episiotomy in your second child. There's an increased chance of episiotomy in first pregnancies compared to second pregnancy. I am not telling you that with your second pregnancy, there might not be episiotomy, but there's more chances of episiotomy with first pregnancy. So the first thing I would advise you to do is to calm your fear. If you really want your child, like if you really want to have another baby, it's something you wish for, you can go for it. As far as you are medically fit, the episiotomy has healed, and you feel your body is ready for it, then you can try with a positive mindset. But if it's not something you want and someone is forcing you to do it, that is where the problem lies. But if it's something you want and you want to do, you can try for it. And you can also speak with your doctor or your midwife in regards to your concerns, so they are able to help you through the period of pregnancy. So that's what I have to say, Rakil, and I hope it helps. So Rahi, why are you laughing? What's happening? Why are you laughing? Rahi. So Mustafa said, thank you very much. I promise I will not be late tomorrow because I really missed a lot today. All right, it's fine, Mustafa. So you can actually watch the live video after it has ended. So that's a good one. So you can watch the live video after the whole video has ended. Rahil, I would really like to know why you're laughing before I leave. So for those that are just coming across this channel for the first time, the live was supposed to last for just 1 hour, but we spent more than 1 hour because we had some questions coming in after 1 hour. And since I didn't really have anything doing, I decided to stay back and answer those questions, which I'm happy to do that. And if you are coming across this live for the first time, you're coming across this space for the first time, My name is Nurse Mercy Mary. Yes, Nurse Mercy Mary. I'm a registered nurse and also a registered midwife. All you need to do is to subscribe to our YouTube channel, turn on the notification bell so you don't miss out when we come live again. Hopefully, we're going to be live tomorrow morning after my morning routine, and I am going to be live professionally like this in the evening by 9 or 10 p.m. tomorrow, where we're going to be talking about staphylococcus. Bone of contention tomorrow. If you want to know a lot about staphylococcus, if you have any questions, any doubts about staphylococcus, kindly come for that live sections tomorrow, and we're going to be talking about it all. So if you're watching this live, and I'm about to leave, and you've not liked the video, kindly do so now. Thank you. And if you're watching this live, you are new on our YouTube channel, kindly subscribe. Thank you. All right. Okay, since there is no questions, thank you all for joining in today's live, and we will be ending the live in 3, 2, and 1. Bye, and see you in my next live sections. Bye, everyone. Bye. For those that missed out, all you have to do is to wait for the video on YouTube. It's going to pop on YouTube. You're going to learn a lot.